Traumatic brain injury, or TBI, impacts an estimated 1.5 million Americans each year. TBIs can result in symptoms that last many years after injury. Cognitive fatigue is one of the most prominent and persistent complaints reported by individuals 3 or more months after injury. After injury, essential networks in the brain tend to communicate less efficiently, which leads the brain to tire more quickly. Unfortunately, traditional measures used to detect cognitive difficulties are often not sensitive enough to capture the subtle inefficiencies individuals experience in their own thinking. That said, cognitive tests are one of the most inexpensive and non-invasive ways to assess what is going on when someone reports cognitive symptoms. So the question is, how can cognitive tests be used to better detect the subtle impacts of cognitive fatigue that these individuals are reporting? Well, some evidence suggests that cognitive fatigue may present as variability in performance rather than a steady decline in performance over time. If that's the case, average scores on cognitive tests are not going to pick up the variations within someone's performance, leaving their subjective complaints invalidated. This study included 88 individuals with and without a history of TBI. We looked at differences in variability and reaction time performance both before and after participants completed numerous other cognitive tasks designed to induce a certain level of cognitive fatigue. Findings suggested a trend such that variability in performance was higher for those with TBI than those without, and even higher for those with more severe injuries. Individuals also showed slightly more variable reaction time performance after completing additional cognitive tasks, which may indicate the detection of cognitive fatigue. Unfortunately, these results were not statistically significant, but the literature suggests that they may have substantial clinical significance. After all, even after many symptoms have worn off, individuals with TBI are still reporting significant effects of cognitive fatigue. It is important to continue looking at how cognitive tests can better detect subtle impairments during the chronic phase of injury. After all, healthcare providers may be more likely to provide adequate treatment interventions if a patient's subjective concerns are validated with objective, quantitative evidence. Given the impact of chronic cognitive fatigue on job performance and social relationships, receiving these interventions may improve the quality of life for those with a history of TBI.